Hello everybody, my name is Roman and I recently had a bimalleolar ankle fracture and I am 17 days post surgery into my injury and I have written a few points about my injury and what all transpired during the process in the 17, 18, 19 days, and I'm going to share everything with you. So I have written points on my phone and I'm just going to read it over for you, so you can sit and listen to what is my story halfway down this journey. So let's start. So I am 32-year-old male from India, now settled in Kuwait. My story starts on a dreadful Friday. It was the 23rd of December 2022. We went to the outskirts in Kuwait, and there's a place called Jahara, and there's a desert safari kind of a thing there. So we went there. So almost an hour of death-defying stunts and surfing on the hills on the quad bike, which we took for an hour. What happened is that my quad bike, it jumped in the air and it turned mid-air and it fall and the elephant-sized wheels, they fell on my leg, on my ankle specifically. So what happened that it all happened very fast, and I banged my head first into the sand. Thankfully it was sand, and otherwise the story would have been a lot different because it was sand. So I had few injuries here there, but not that much. As soon as the wheel crushed my ankle, it was such a high momentum thing that immediately I thought that what if my ankle was broken. Anyway, I stood up immediately and saw a little swelling around my ankle, which is 100% a bad omen in these kind of impact injuries. And I couldn't put weight on my right leg at that point in time, which is a big indication that something is different with you. Something is problematic if we can't put weight on any particular leg during an impact injury. We rushed to the emergency and met the doctor at the orthopedic OPD at that time. He suggested x-rays. And once the x-rays returned, the doctor told us the bad news, which was I fractured my ankle. And what he said that I should go again to the x-rays and try out x-rays with different angles. So once we came back with another set of x-rays, the doctor gave us the worst news, which was I fractured my leg in two different places in my ankle. So I had a bimalleolar ankle fracture, and he told that my lateral and medial malleolus both were broken, both were fractured, and I had to go through a surgery. Surgery was because this was not a stable fracture; it was an unstable fracture, so I had to go through a surgery. He told us. So I was shocked because I heard the word surgery, and I had booked my tickets for a month-long vacation in India starting from 29th of December, which was 6 days ahead. And suddenly all the dreams of fun and enjoyment came down shattering, and it was so tough to accept this new reality. Anyway, since Kuwait has medical insurance for all the residents, I was immediately admitted at the ER, and IV was inserted in my right hand. And since I was never admitted to the hospital before, this was quite an overwhelming experience for me at that time. They gave me pain relief, but thankfully I had no pain at this point. I really thank God for not giving me pain. I had my blood taken for CBC and blood gases, and an MRSA swab was taken from my nose, and I was bombarded from with questions like, do I have diabetes, do I smoke, do I have any allergies. Apparently these things complicate. I was even x-rayed for any knee injury, but thankfully there was none. Soon I was shifted to a normal orthopedic ward where the patients like me were kept before and after their surgeries. I was accompanied by my wife and my uncle to the hospital. There were 4 beds in my spacious room, and with my curtained personal area of about 10 to 10 feet area for me. Upon admission, my wife got me some snacks so that I can munch on them. Now, they left around 7 o'clock in the evening, and mind you, I am a night person. So it was 7 o'clock. It was night. I had a dying phone in my hand and a broken ankle. Uh, it was the toughest night probably for me at the hospital, and going through that night still give me chills if I think about that night. Now with the alone time, I had to think and rethink all the possibilities, all the scenarios which happened that day. And oh my god, how many signs did I have that day that I should not go there, I should not go there, but we went. There were many times I could have possibly injured myself with what we were doing at this with the quad bike, and but things went perfect, so nothing happened. But whatever happened was meant to be, and it took me a couple of nights to accept the fact that I was injured and bedridden for some time now. The next day, the doctors came with an entourage and they asked the nurse to open my cast. And so my cast was a traditional below knee cast, and the cross sectional half was plaster cast, and upper part they rolled the bandages around my lower half. So it was a 50-50 kind of a thing. The half cast was plaster and half was bandages. So it opened easily with scissors, and my foot was swollen like anything. I asked my doctors many questions at that time, and they answered all my queries. Even I asked them where exactly I had my fractures, and they pointed on my leg where I had my fractures. The doctor told me that my skin was not in a condition or of being operated, so I have to wait. And I was put on a cast again and told to keep my foot at a height, and I was given some ice treatment so that my swelling comes down. That night the discomfort increased. Still I had no pain, but now moving my injured leg was not that easy, and my foot felt very brittle, and I was afraid of any sudden movements. But it all went away when the nurse gave me paracetamol through IV, and it worked like magic on me, and it relaxed the increasing complexity in my injured leg. Still, I couldn't lie on my left side because on that side my ankle was paining if I put a little bit weight on that side. The next day, the doctor's entourage came in early and repeated this process again, and they deemed my skin ready for operation. It was a mixed feeling knowing I was being operated since I had almost had no fracture based pain until this point. I had a good feeling that okay, now is the time I'm going to be operated. Still, I had some fear. In the evening, the anesthesiologist came and he asked me whether we would do the full body anesthesia or the spinal anesthesia, and for that we discussed with the doctor and we went for the spinal anesthesia, which was lower body anesthesia, and we finalized that. Until now, my days were going on a countdown to the day of surgery, since my day of surgery would be the day zero of recovery, and that day came. And I had been fasting overnight, and the nurse started prepping me for surgery. I wore a white surgical gown with my wife on my side, and I was feeling a lot ready for surgery. The nurse strolled my bed through the ward and hallways and the lift to the operating arena main doors. My point of view at this moment was moving white ceiling lights, which usually the directors show in the films. Reaching the operating arena main gate, my family was stopped to go any further, and it was a solo fight for me from this point. Upon reaching the operating arena, it was quite clear that I was not the only patient to be operated, and there were many patients on their respective beds, and our identity was a name tag on our feet, and a file which was on the bed. So this was our identity. Soon I was shifted to the waiting room. I was being checked for the pulse, BP, heart rate for about an half an hour, and then one by one, all the patients started going to their respective operating rooms. Upon reaching the operating room, I heard the voice of the orthopedic doctor who saw me on the rounds before, which comforted me. Once I got there, they shifted me to the operating table, and I was literally shivering at this moment with fear. And of course, the temperature was very cold. They were the main culprits for me shivering, the fear and the temperature there. A senior doctor spotted this, and they advised the nurses to first give me a blanket with a heated air duct inside, and the anesthesiologist he greeted me, and I already discussed that we were having a spinal anesthesia procedure. So they started the procedure of the spinal anesthesia. I was told that it would be slightly painful, but thankfully it was quite easy for me. So the feeling of anesthesia is very different, and the touch sensation is there, but there is this the sensation is like no other. So it you know that something is happening with you, but you don't feel it, but you know that something is happening with you. Once the anesthesiologist gave a green signal to the nurses, all grouped around my leg, and I felt an incision on the inside part of my ankle, which is the position of medial malleolus. The doctor was a bit concerned about this bone, and some after some time I felt a drill and then another on my medial malleolus. What I saw on my left hand side was there was a monitor, and X-rays were being projected on that monitor. So almost after each step, the doctor requested for an X-ray, and now I had something to look upon. So I looked on the monitor, and I was constantly peeking that what is happening with my leg. So this medial malleolus took a long time, and the doctor informed me before that he will put a tension band probably. Then he proceeded to the lateral malleolus, and it was swift with this side. And almost after an hour, the doctor said 63 minutes total, and indicated to others that the surgery was finished. Soon I felt that my leg was being stapled. I just had a feeling on my skin. There was no pain. I saw the whole surgery on X-ray monitor, and I almost knew what was happening at exactly what point in time. During my surgery, the anesthesiologist he checked with me constantly of my health, and he constantly talked to me through my surgery. Once the surgery was finished, I was transferred to my bed and was strolled from the operation theater, and I was taken to the post surgery room and was evaluated for almost in half an hour for my vitals. And once I started moving my toenails, they called my ward and told the nurses that your patient is ready to go. So one nurse came after some time and took my name and signed few papers, and started strolling me through the same corridors and the lifts to my ward. Once I reached my ward, I informed my wife, and she came with a sense of happiness and gratitude in her eyes. I was very excited at this moment since I had no pain, zero pain at this moment. I was operated, and the experience in the operation theater was like no other. It was surreal in the operation theater, and this experience, I would keep this experience with me until I die. But a little while later, the effect of anesthesia started going away. Now the brain greeted me, hello. And this is the first time in these 4 or 5 days I was having some kind of pain, and an hour later I was reeling in pain, which I had manifested already in my mind from last 3 days. And on a scale of 1 to 10, if I had imagined 10, the pain was 9.9. My wife saw me in pain and she called the nurse, and they gave me some high quality pain relief in IV, but it didn't help. So the pain didn't reduce, it just went up. Also, neither of my usual time passes like watching reels on Instagram, they didn't help me at this point in time. So I was reeling in pain at that point. But my mind was diverted once a few relatives came to see me. Once they left, I was accompanied by some friends, and those 8 hours post surgery, they were very tough for me, and it was almost the maximum pain I could have handled. The duty nurse then gave me around 9 o'clock paracetamol in the evening, and it worked like magic, like before. So soon I started feeling better, and I slept. Thankfully, I slept that time, and I woke up around 3 o'clock in the morning with some pain, and trying to sleep again. But then I requested the nurse to give me another dose of paracetamol, and since it was 6 hours, they gave me another dose of paracetamol, and I slept again. I got up in the morning almost pain free, and the doctor's entourage came again and told me that they will open the cast after 2 days, and if my surgical wound would be dry at that time, they would discharge me. So I waited for 2 days and kept my leg elevated at all the times. And the doctors came again after 2 days and opened my cast, and they were happy with my recovery. And the physiotherapist taught me how to walk with one leg and four-legged walker. And I was strictly asked not to put any weight on my injured leg, and my non-weight bearing period was 6 weeks. So upon discharge, I came to my home, to this wonderful setup at my house, and my wife greeted me with these flowers and a wonderful decoration, and there's no feeling which is coming back to home. I was scheduled to see the doctor again after a week, and next week when I went to see the doctor, who asked to open the cast to see the surgical wound and did some x-rays, and he was happy that all the things were falling into the place. He gave me an appointment of next week to open my staples on my surgical wound, and a week later I went again to the hospital to get my staples out. And this is the day I am recording this video. So today I got my staples out. It's 17 days past my surgery. Some of the staples were deep inside my skin, and some were peeking out. The ones which were deep inside were more painful, and I had a few blood drops here and there at the position where the staples holes were there. I had a total of 15 staples, 12 on inner side and 3 on the other side of the ankle. Once the staples were taken out, I had my cast again, and now I have an appointment next week with my doctor. So this is my story of my bimalleolar fracture, and I know that the fact that no two cases are same. And if you are seeing this after your injury, maybe you are dealing with the issues which I had not faced, and I really thank God that He didn't give me any kind of pain, and I really hope for you that you also will have no pain in your injury. I also thank my wife for supporting and giving me the care I need, and I would be recording my journey of my injury. My father says that 50% of your health depends on what you think. So I would like to think positive, and I would like you also to think positive about yourself, and just see this moment as a learning curve, and also a point that how to make yourself a better person. So hopefully once we all come out of our injuries, we will be a better person. I would be recording the other part of my injury update soon, once I have enough details, and I will keep you updated about my injury, whatever happens. So stay tuned, and happy health to all of you.